So I'm from Colorado Springs, Colorado. I was born in Tucson, Arizona actually, but moved to Colorado when I was very little. So I went to college at the University of Denver, studied biology and religion and wellness. I met Rebecca Hennessy, my wife, in medical school. We both did our residency training at the University of Arkansas. We both wanted to do a rural family medicine track. It was an unopposed program where there's no specialists around, so you kind of get your hands dirty and you kind of learn a lot about self-reliance and a very sick population also, so it was very rewarding to work there. We did training prior to residency. We both did postdoctoral research fellowships at Mayo Clinic in Rochester, Minnesota. Our training in Arkansas was great. I was the chief resident there for my third year, my last year. So when I was in residency, I went to a couple family medicine conferences, and one of the recruiters for Schneck was there, and we really kind of befriended each other. And after we toured here, there was no question we really loved it. Everyone was so nice. Everyone seemed to work together as a team. That synergy is hard to find. You know, we've worked at a lot of institutions, and I would say that it's few and far between. So when we had even the opportunity to interview, and after we saw the facility and the staff, and whether it be from administrative all the way to nurses and physicians, we were sold. So also, it's rural. We didn't know much about Seymour other than John Mellencamp was from here. So we always wanted to be in a rural place also. So that's why we did our training in rural medicine. So sometimes when patients aren't really around any specialists, or if it's an hour drive to get to a big city, sometimes they don't want to go anywhere. So it's good to be able to try to get the best medicine you can in a small place. I love the patient population, being able to see someone from once they're born or during delivery thereof to when you're in your 80s, 90s, hundreds. The oldest patient I ever saw was 112 years old. One of the oldest people in Arkansas where I was, and it was unbelievable. Being alive for a century is incredible, or over a century for that matter. But you never know. Every patient's different, and everyone's always unique in their own way, and everyone has their own problems they deal with, and being able to try to help guide them through that. Sometimes things can be scary, and I'm trying to help them along and figure it out with them, I think, is one of the most rewarding things. So every day is different. So at family medicine, we have the luxury of seeing patients with all sorts of course, problems, and/or if they don't have problems, wellness visits, or just a physical, to complex things like diabetes and heart failure. But anyone essentially from birth to their senior years, so twilight years. I try to be very thorough if I can. I try to spend time with the patient and get to know them. Treat them as a person, not just a account number or a patient number. I think that's very important. Trying to relate to the patients, trying to understand what they're struggling with and what they're trying to go through, and being part of this patient-centered medical home, I think, is also very important. We work for the patients, so we are there to try to either go through a problem with them or help them figure out some strategies for dealing with things. And if we don't know, we own that and try to figure out someone who does. We like going to movies, spending time outside. Skiing in the winter is great in Colorado. My wife's from Michigan, so going up there and going to Lake Michigan is also very nice. Spending time with my wife and family. We have a 3-year-old and a 3-month-old, so other than being chronically exhausted from them, it's also very rewarding and wonderful. The thing is, when you go through medical school or you go through your training, you learn about all different types of people and populations, and I would say once you go through that, it impacts you more than just reading about it or thinking about it if you haven't done it. But that does change your life and kind of makes you more thankful for being alive. And I would say it's always very rewarding, I guess, on our side as a provider to care for someone, like I said, who's vulnerable or is going through some life-changing events in their life, and trying to be there and be as supportive and helpful and a guide as much as possible.